everybody. Today we will be discussing feminist therapy from chapter 12 of your textbook. And the first thing we're going to do is go over the history and development of feminist therapy. First, as with the other theories that we have went over, each theory has had a founder. Well, feminist therapy does not have a founder, and no single individual can be identified as the founder of this approach, reflecting a central theme of feminist collaboration. Feminism, or the first wave of feminism, began in the late 1800s, and the women's movement of the 1960s, which was the second wave of feminist therapy, laid the foundation for the development of this particular therapy. Some key concepts from feminist therapy consist of problems being viewed in a socio-political and cultural context. The psychological oppression that women and minorities have experienced is acknowledged through feminist therapy, whereas, for instance, with psychoanalytic therapy, which was created by Sigmund Freud, it was based off of men, and white men at that, and also affluent white men. And a feminist perspective considers the roles that women and men with diverse social identities and experiences have been socialized to accept. In feminist therapy, the client knows what is best for his or her life and is the expert of their life. And there's an emphasis on educating clients about the therapy process. So the traditional ways of assessing psychological health are challenged through this form of therapy, and it is assumed that individual change will best occur through social change, and clients are encouraged to take social action. As it relates to personality development, societal and gender role expectations profoundly influences a person's identity from or even before birth. Gilligan, 1977, recognized that the development of women was judged by norms that were set by males, and females are raised in a culture grounded in sexism, and understanding internalized oppression is central to this approach. And as it relates to sexism, if you think about the news and everything that has been going on over the past 2 months, where sexual harassment, cases of sexual assault have come out as it relates to prominent celebrity figures such as politicians, news reporters, and also celebrities. And it is a big part of debate within our society at this time. Relational cultural theory emphasizes the vital role that relationships and connectedness with others play in the lives of women. Therapists who adopt the relational cultural theory approach aim to lessen the suffering caused by disconnection and isolation, increase clients' capacity for relational resilience, develop mutual empathy and mutual empowerment, and foster social justice. Some additional principles of feminist theory includes the personal as political and critical consciousness are central concepts. Those who practice feminist therapy are committed to social change. Women and girls' voices and ways of knowing and the voices of others who have been oppressed are valued. And the counseling relationship is egalitarian. Feminist therapy focuses on strengths and offers a reformulated definition of psychological distress, and all types of oppression are recognized along with the connection among them. Feminist therapists help clients become aware of their own gender role socialization, identify their internalized messages of oppression, and replace them with more self-enhancing beliefs, and clients are able to understand how sexist and oppressive societal beliefs and practices influence them in negative ways. Other goals of feminist therapy includes acquiring skills to bring about change in the environment, developing a wide range of behaviors that are freely chosen, restructuring institutions to rid them of discriminatory practices, and evaluating the impact of social factors on their lives. Also, developing a sense of personal and social power, recognizing the power of relationships and connectedness, and trusting their own experience and their intuition. Now, the role of assessment and diagnosis as it relates to feminist therapy. Diagnoses are based on the dominant culture's view of normalcy and cannot account for cultural differences. So again, Alfred Adler, Sigmund Freud, Carl Jung, these were white males who were of affluent means, and their theories were based off of one perception. It was a male-dominated perception. And also, these perceptions were developed by white men. Persons of color were not taken into account. Feminist therapists have been sharply critical of the DSM classification system, including the current DSM-5 edition. And the critique is based on research indicating that gender, culture, and race may influence assessment of client symptoms. Some techniques and strategies that feminist therapists used are empowerment, self-disclosure, gender role or social identity analysis, gender role intervention, and power analysis. Bibliotherapy, assertiveness training, reframing, relabeling, social action, and group work. In feminist therapy, there is a role for men. Men who are feminist therapists are willing to understand and own their male privilege, and they confront sexist behavior in themselves and others. And also, men who practice feminist therapy redefine masculinity and femininity and work toward establishing egalitarian relationships, and they engage in and support women's efforts to create a just society. As it relates to group work, the group provides an outlet for social support and political action. It forms a diverse community where members share the goal of supporting women's experiences, and the group setting decreases feelings of isolation and loneliness. Self-disclosure is emphasized for both the leader and members as a means of self-exploration, and it provides a setting where clients learn to use power appropriately by providing support for each other and taking social political actions. Feminist therapy has the most in common with the multicultural and social justice perspectives. Clinicians strive to create an egalitarian relationship and collaborate with clients in setting goals and choosing strategies. And feminist therapists believe psychotherapy is inextricably bound to culture. Now, as it relates to diversity, there are some limitations. Advocating for change in the social structure can be problematic when working with women who do not share these beliefs. There are many women who are not feminists. There are women who believe that men should be the head of the household. They believe that men should open doors for them. They believe that men should take care of the household. There are women who are stay-at-home moms and who do not want to go into the workforce because they want to raise their children and not be distracted by work. And there are many women that believe this, and as a result, they're not supportive of the feminist movement or the feminist theory, because with feminism, we're stating that as women, we are equal to men. Everything is 50-50. If you hold the door open for me, I should hold the door open for you. Everything is split down the middle. No one is feeling to be made where they are the superior in whether a relationship or in society. If you think about certain religions, if you go to certain churches, one side the men sit on, and the other side all women sit on that side of the church. Or sometimes there are societies where women and men cannot be in the same room together. And there are women who support that because that is their tradition, that is their belief, and they do not believe in feminism. So that is a limitation from a diversity perspective. And if therapists do not fully understand and respect cultural values of clients from diverse groups, they run the risk of imposing their own values. Feminist therapy has paved the way for gender sensitive practice and an awareness of the impact of the cultural context and multiple oppressions. And it has an emphasis on social change, which can lead to a transformation in society. And it has made significant theoretical and professional advances in counseling practice. It has called attention to child abuse, incest, rape, sexual harassment, and domestic violence. And it has demanded action in cases of sexual misconduct at a time when male therapists misuse the trust placed in them by their female clients. And you can also incorporate principles and techniques of feminist therapy into many other different types of therapy models, such as psychoanalytic therapy or person-centered therapy by Carl Rogers. Therapists do not take a value-neutral stance. Therapists must be careful not to impose their cultural values on a client when using feminist therapy, and therapists may alienate clients if they challenge societal values that subordinate certain groups without first gaining a clear understanding of the client's culture. The heavy environmental, social, political focus may detract from exploring a client's intrapsychic experiences, and more empirical support is needed for this approach. Excuse me. And so what that means is that we're still developing research as it relates to feminist therapy. Feminist therapy is not used in many counseling settings due to the fact that many insurance companies will not reimburse agencies for using this particular therapy because of the fact that there's not enough research out in the literature to support the success and successful outcomes for individuals who are counseled under this particular model. Training in feminist therapy is often offered only sporadically in a non-systematic way, and there is a lack of quality control, and a lot of that has to do with the fact that this theory is fairly new as far as being implemented in current counseling practices, and as a result there is a need to develop further tests and measures to determine the success and outcome of this particular therapy. That is the end of the slideshow. If you have any questions about this lecture, please email me or call. Take care.